Trauma-based psychotherapy is a very important skill set we all need to develop, because no matter who we tend to see, people with depression, people with anxiety, people with panic, people with substance misuse, trauma very often is the root cause or an important contributor. And here's where I'm going to be doing some confessing to you, David, and to the listener. It wasn't until relatively recently, relatively later in my career, did I appreciate two things. Number one, how commonly trauma influences our lives as adults. Number two, a different skill set is necessary. It doesn't mean we get to reject what we have learned already, but there is a different skill set that is required. And I'll just offer you a few elements of what I have learned. And what I've learned is the incredible value of gentleness. And as a physician, gentleness was never taught to me. It was get to the point. Let's get to it. Have you had abuse history? What shall we do about it? Essentially was the rather dominant view of how to elicit trauma histories and to address it. But now the approach that we take is far gentler. It's much more of a joining with the patient, reminding them that for most of us, traumas have been part of our lives. And most of us have actually dealt with that trauma effectively in such a manner that it doesn't damage us. So asking people in your life, what role has trauma played? Even things that you may not have thought of trauma, let's actually talk about it. And how does it diminish your life, impact your life negatively? That is the approach to take. Not everything unfolds in one conversation. It's okay to have a conversation about trauma and trauma-informed psychotherapy as a rolling process. It's also very important to remember that patients are deeply defended against talking about, even with themselves, about trauma. So the advice I give to my young trainees is, remember, you don't want to open up something that you don't know how to close. So wait for the invitation. Wait for the relationship between you and the clinician to have advanced to a level where there's great trust on both sides, that you two as a team can deal with some very painful things and not walk out of it even more traumatized without any healing. So those are just some of the core principles to get the ball rolling.